good ones which are not about climate, and now I'm like.
Good afternoon. My name is David. Welcome to our next session, Rising Temperatures, Rising Concerns. I'd like to introduce our moderator and our panelists. Our moderator is Tom Polton, a 1983 graduate of the school, and our panelists are Barrak Alahmad, Gaurab Basu, and Lindsey Burghardt. If you have a program, their bios are there, so I won't repeat it. And I'd like to introduce Tom.
Thanks, David, and welcome to everybody. I'm happy to be here with you. Extreme heat is swiftly becoming one of the leading weather-related threats to public health across the globe, exacerbated obviously by climate change and the increasing frequency of heat waves. And today we're honored to have this esteemed panel from the faculty and alumni who can share their insights on this critical role. But I don't want this to be a passive session. This is really about thinking about what our action plan should be to address climate change. We need all of you involved, as you heard Renee talking earlier today. As there are experts up here, but there are experts that can make a contribution in the audience, and I hope that you think about ways that you can put together your own action plan to address climate change. It may be individualized on what you do with your own personal lives. It may be related to your professional roles, or it may be what we can do collectively as an alumni organization affiliated with Harvard. And by the way, the last session of the day, we are going to want to interact with you and get a better sense of what actions you think are needed around this. So it isn't just a listening session, but one to get around. And during this session, we're going to help to understand the magnitude of health impacts from rising temperatures. We're going to talk about the most vulnerable populations and how they're impacted, and then learn ways that there are outstanding efforts underway, as well as actions that are needed, because by no means is this one fully addressed. So to kick things off, I'm going to turn to Gaurab, but who's impacted by extreme heat, and what primary health impacts do we see? And in terms of sensitive populations that you encounter in your practices, what are you finding?
Sure. Nice to be with you all. I'm the adult primary care doc, so I'm the adult generalist, and then Lindsey will give you the pediatrics generalist, and Brock is our specialist here. So,
did not expect that.
Maybe I'll start this way, is that, and I know many of you probably know much about this already, so I'll say it briefly, but our body works very hard to sustain a core temperature. It will sacrifice other things to ensure that it keeps a good core equilibrium temperature. And so when it gets very hot, and I'll put up front that humidity is a really critical part of this also, your body will work very hard to dissipate that heat so it does not get absorbed into your system, because there's inflammatory pathways and enzymes that don't work, so it's a high priority. But that makes your body work very hard. It will shunt blood away from certain organs to others. It'll make your heart work a lot harder. Sweating, obviously, is a very important piece. So your body is very activated to work against allowing heat that's on the outside to get inside in a way that changes your inside temperature. So to get to Tom's question, who does that impact? Well, you have to just think about people who struggle to make those compensations, right? So maybe we'll start from a physiological level is people with underlying cardiovascular disease, people with diabetes, people with, a wide variety of kidney disease, cerebrovascular disease. So if you have underlying disease processes, that makes it hard to make those compensations. I won't say too much about this. Lindsey will tell you more about kids, but very young kids have a hard time compensating. The elderly have a hard time compensating. And I'll just put at the front, it's not just what's happening inside the body, but the way we built the world, right? That's why we're all here. And so issues of structural racism and the ways, there are communities that on, 95 degrees in Cambridge, where I live, Chelsea is 115 the exact same day because of lack of tree canopies. Then you do the analysis historically and see redlining and how those investments were taken away. And those communities that are asphalt and have fossil fuel infrastructure, and a lack of green space, and again, that was not by accident, those communities are extremely, much more hot than wealthier communities. Maybe I'll just close by, the face I have in my mind when I think about heat is I'm a primary care doctor and I work in a community health center. So the first, I probably, the first face I think about when I think about climate change generally, and especially about heat, was this young man who's 30 years old, who was from El Salvador and had been in the United States for a few years, and was having upper respiratory symptoms. He was just thought he had a cold, and the symptoms were lingering, so much that his family was really nudging him to get checked out. He had an established care in the United States, and I think they thought maybe he was getting a pneumonia, needed some antibiotics, something like that. Came into our emergency room, and a total shocking diagnosis that he had end-stage renal disease. A young man who his wife was pregnant. He had every reason to think he was healthy. Usually with kidney disease, of course, we think about diabetes or high blood pressure, older folks. This was a young, healthy guy. And just to get to the diagnosis, all those things were ruled out. Intrinsic renal disease was ruled out. And it was that he was a sugarcane farmer back at home, and he was out in the heat day in and day out. And so good ecological studies show us that the dehydration he was exposed to, because, and Barrak will say more about this, about the lack of kind of workplace protections for him. He was out tending to the crops, especially with sugarcane farmers. We were seeing this particularly in Central America, but around the world. He was just out and exposed and totally unprotected from the elements. And so his kidneys were getting dinged up slowly until they were in failure. So he's my patient now in primary care and on dialysis, and having a very up and down course. So his life changed completely. So I think we need to make sure those faces are made visible because they're often invisible and are really the moral anchoring of the work we need to do.
Yeah, and I think it's interesting that you're going to hear about different vulnerable populations, and you may look at yourself and say, I don't fit into any of those categories that are being described today. But as I heard one speaker talk about at Climate Week this past week, that we're only one power outage away from being the part of that vulnerable population. And as we see the fragility of our electric grids, we can't be reassured by the fact that we face air conditioning, but we are all have that existential threat of heat stress that's out there. So switching to a different generation, Lindsey, why don't you talk to the impacts of heat stress on other vulnerable groups?
Yeah, thanks, Tom. Thanks for the organizing group for having us here today. And I don't know, whenever I come back to Chan and I hear people like Gaurab speak, I do feel a lot of hope, because it's amazing to have people who understand this issue also taking care of people in the community. So it's really nice to be here today. So, Gaurab mentioned that your ability to deal with stress from heat depends in large part on your physiology. And when we hear about heat in the news, we very often, and rightly so, hear a lot about the impacts of heat on our population as a whole. And I think we hear a lot, again, very rightly so, about the impacts on the elderly and those who are isolated. But, there's these other groups who are also very, very affected. And I think when you start to consider the effects on young children, infants, and pregnant people, we really start to see and understand a group where the effects of heat are often invisible. They're really unique because of the unique physiologies that happen during this time. And when we start to look at what developmental science is telling us about the effects of heat on very young children and during pregnancy, we sort of unlock this huge solution space of all these other ways that we can step in to protect people. So, when it comes to pregnancy, there's normal adaptations that happen during pregnancy. I'm sure there's experts in the audience about this, like an increased metabolism to support fetal development and increased body mass from increased weight during pregnancy. And these put additional risks on pregnant people during heat, even though they're normal adaptations that are important to carry normal and healthy pregnancies. And when it comes to young children, their small bodies actually heat up much more quickly than ours do, especially when you look at infants. They breathe more quickly at baseline. And they have, Barrak mentioned, how our bodies work very hard to maintain our core temperatures in this normal range. There's two ways that we do this. We redistribute blood flow to our skin so it can dissipate into the environment, which works if the air temperature is less than your body's core temperature. But also, really importantly, we sweat. And young children, and infants in particular, do not sweat as much as we all do. And additionally, there's this behavioral restriction where they're dependent on all of us to move them to cooler environments, to get access to water when they're thirsty. And the majority of their nutritional needs, whether they're breastfed or formula fed, are fluid dependent. And so they're further exacerbated by these losses during heat. And we have a really growing and convincing body of science that shows us that during times of extreme heat, there are more babies that are born prematurely. And this is, again, probably from a variety of mechanisms, but dehydration, inflammation, decreased blood flow to the placenta. And this is really, really important because not only does being born preterm increase your risk of dying or becoming very ill in infancy, but it sets off your risk to be heightened for a range of adverse outcomes throughout your life course. And this, to me, is one of the spaces in public and in policy discourse where we are vastly underestimating the effects of heat, both from an economic and from a health burden perspective. So we'll see more of these babies in our NICUs and in our hospitals, but they will also be more in our early Head Start programs, in our individual educational program needs in the public school systems, and in the adult care systems when they grow up, because being born premature raises your risk of the burden of chronic diseases that everybody in this room cares about, cardiovascular disease, diabetes, across the life course. So when we lean in and protect pregnant people from the effects of heat, we're then making this huge opportunity to decrease and turn off this adversity at the source so that fewer of these babies reach, these adverse outcomes later in life. And then in kids too, these other invisible effects, in addition to fetal development, we think about really important impacts on learning loss and their ability to learn in schools, very important impacts on their sleep, which is a pillar of health across our life course, and then impacts on their mental and behavioral health, which I think, again, is hard to quantify, but is a really important and meaningful outcome.
Yeah, I think it's important for us to hear not just the mortality information, but the morbidity impacts that heat stress has. So let's turn to another group. Heat is not a new risk, and particularly in the occupational setting. I studied here a while ago. Alice Hamilton had left after when I was here. We didn't overlap at all. I don't go back that long. But when we looked at occupational health risk from heat, it was largely steel workers and coke ovens and the furnaces for handling molten metal, and maybe workers entering confined space, suited up and entering into tanks and the heat stress. But talk about who's at risk today from the heat stress and what the worker profile looks like.
Yeah, absolutely. So I come from Kuwait, which is synonymous for heat. So I know a thing or two about heat because I lived heat all my life. There is a BBC documentary called Life Under 50 Degrees Celsius, which basically shows life in Kuwait, where I come from. But the problem that got me into public health was seeing migrant workers, large sections of migrant workers that did not have the luxury of just staying at home and turning on the AC and then just cool down. Because there were buildings, there were construction deadlines, and there were supervisors that just keep pushing these workers to meet these deadlines, which they don't get met anyway. Construction, there's always delays in deadlines. But you keep pushing and you keep pushing, and the workers are just sweating and trying so hard to compensate for all the heat that their bodies are trying to thermoregulate. And this resulted in a very unique symptom that is not commonly seen in public health. Because when you learn the basics of public health, everyone tells you, oh, the worker population, they're young and healthier than the general public. Because the general public has comorbidities, the elderly, disabled people. And then you would think that in general, there are better health outcomes for the migrant population because they're young and healthy, supposedly. But we're seeing the opposite direction. We're seeing them to be sicker. Their health outcomes in certain aspects that are worse than the general public, which was alarming. There's like red alerts everywhere that says there is something going on here, and heat is one aspect of this. And it is not something that is completely new to occupational health. Heat has always been there in occupational health, in agriculture. The example that you mentioned about someone working in El Salvador in these sugarcane farms, they require a lot of metabolic work rate, cutting and working so hard. So your body is putting a lot of internal metabolic heat on top of the external heat as well. And in other cases, there would be people that have to wear certain clothing for the safety. That makes it even worse. So there are many aspects that comes to it. The surprise that came to me when I was doing my PhD and now even after my PhD is that heat is very poorly regulated in the workplace. In fact, OSHA right now has no current standard for heat. There is a proposed standard that just came out in July 2nd, 2024, which is about 2 months ago. And even that, the current law of the land, I was just telling Tom earlier that it is regulated under the general duty clause of OSHA, which is just to protect, in general, all the workplaces, make them free from recognized hazards, which does not make sense. But when you get to the weeds of it, there is plenty of work that needs to be done in the science part, and then to push this in the regulation in the US and also everywhere else in the world.
So building on that, though, we are in the midst of the OSHA standard. Comments will be due by the end of the year. I'm just curious, we have people who may work in these fields in the audience or watching this ultimately. Right. What kinds of information and comments are needed to make this happen, and how might folks contribute to that effort?
So this is a very interesting question because we're in the middle of it, literally, because for OSHA to push out a standard, it needs to go through a number of regulatory stages. And the average time that OSHA takes to get out a regulation is between 5 to 8 years. But the good news is that we're somewhere in between right now. So we're at the point where there is a proposed rulemaking that is out there. It came on July 2nd. And it was published on the Federal Register on September 1st, which gives 120 days of public comment that us as scientists and members of the general public that can contribute to this rulemaking. And then after that, OSHA will have to sit down and analyze everything and then come out with a final rule that will also then be put out for the public comment. And there usually would be maybe a compromise or not. And then this becomes the standard. But keep in mind, there is political factions as well that happens in this time. There's who decides to push the standard out and who decides not to do that. And if we can lean on the Supreme Court, there is also challenges that could happen here in the US. But what OSHA did right now is that in their standards, they said, okay, there must be some kind of thresholds. So they tried to put a number on what is the temperature that at some point you'd have to put some precautions for workers. And there is a 500-page summary, but they said 80-degree Fahrenheit as heat index, which is just a combination of humidity and temperature, does not include the radiant heat if you're under the sun or you in the shade. It does not include wind speed, but it includes only these two elements. And they said at 80, you should just put some precautions, some measures. That includes shade. That includes something like providing water. But then when it gets to 90, which is the other threshold, then you have to kick in and give in 15 minutes of paid break for the workers. And here is where the controversy would be. Why 15? Who is going to pay for this? Is it sufficient? So you got people on both sides pushing for and against this. So that is at the crux right now of the battle in trying to push this out. And I think Lindsey also can speak about the White House and how the White House is also pushing, not just for this, but for other stuff for climate action.
But just to jump in there, think about how unproductive you would be suffering from heat exhaustion. And a 15-minute break was likely to even restore you to be able to work more efficiently, more effectively, and that the productivity benefits from this probably would be something that employers would want to endorse in order to make it happen.
Yeah.
But let's,
and if it's okay, just
Yeah,
to add to that, I think we see very similar parallels in children, and that there's very often regulations, whether it's schools or early care centers, for when it's too hot and you're not allowed to take children outside for recess. And we got a lot of calls from media and others this fall asking about this, because when the outside temperatures get very hot, the playground equipment heats up very, very quickly within a matter of minutes, and the kids can get very severe burns. That's even if they have playground equipment. Oftentimes they're just playing on asphalt. But there's right now very few places, very, very few, that have any regulations on indoor air temperature in schools. And so the point that I tried to make in those conversations, that it may actually be, in some cases, more dangerous to keep the children indoors, because in places that were experiencing this, like Boston and Detroit and Chicago, our schools were designed to keep heat in the winter. They were not designed to stay cool. And so we get these really profound indoor heat waves. And not only are the kids affected, but the teachers as well. And we can take, I think, what we've learned from these school settings about productivity, about the effects of heat on learning and education. We see that over a 1-year school period, a degree Fahrenheit air temperature increase correlates with a 1% loss in learning. And if you look at school performance on tests, on psychological measures, you can see performance increase by about 20% if you lower a classroom indoor air temperature from 86 degrees to 68 degrees Fahrenheit. So it's sort of a no-brainer when you look at the data, but this was brought up in the earlier panel about communicating this effectively to the right audiences, that it's getting that message across in a way that marries it with the policy. But I think that we can take, what we learn in these different settings and apply it, because it's true no matter your age, the effects of heat on cognition. And we see it at a biological level too. And then you see it on a behavioral level, that heat actually disrupts the neurotransmitters that regulate your mood, and it makes us more irritable and more aggressive. And so there's these compounding effects, not only on gross productivity, but also on these like social emotional aspects of the workforce in a school.
So just keeping with you, I know you were involved this month, I believe it was, that the White House introduced its first summit on heat, and maybe you can give the audience some perspectives on who was there and what was discussed and what the outcomes may be.
Yeah, I'm happy to. And I think it really made me think of a lot of the conversations earlier this morning about, what are the actionable steps to breaking down silos and to actually getting some of these available funds and policies into action. President Biden announced this White House summit back in July and brought together, there were about 100 of us that represented different sectors, everybody from people working on energy efficiency in Maine to people from the high-level ranking military officials, a couple pediatricians, some OB providers. And it was a chance for them, in part to share out what the different agencies were doing and the commitments that they made either through the BIL or the IRA around mitigating the effects of extreme heat. And how in part they had worked to communicate those commitments out into the public and to get them into the hands of those who wanted it. And then we had a closed door sort of public health and health session with about 15 of us of essentially asking, what do you think we should do next? Which is kind of so, for me, the take home from the share out session was that even as somebody who lives and breathes and only talks about extreme heat to the point where my kids are honestly enough, no more, there was so much that I wasn't aware of. When the transportation people talked about heat commitments to bridge infrastructure, it was amazing. And I think there's so much that's being done that talk about communication. It's just, we're not connecting a lot of these dots about how the ways that our existing commitments are addressing things that need to be addressed. But then I sort of shared with them that I felt like a place where public health can help is making the connections between these incredible commitments and the communities that need to be able to access these funds. And I think they were very receptive and interested in how to do that. I don't have all the answers. I have opinions, but I think connecting the people who are living and experiencing heat in communities and really implementing meaningful and replicable and accessible ways to access some of these funds and get them into communities feels like a really important step.
Well, you did a great setup talking about the communities to turn over to Gaurab. Last night, I don't think you were there, but we had the mayor of Somerville, and she was talking about how communities are used to having snow day preparations and emergency plans but they haven't taken into consideration how they preparedness for heat and extreme weather might also be part of that. But I'm just curious from a frontline clinic standpoint, what you think is needed both from an educational standpoint to physicians in practice, but how community and clinic readiness can help to intervene on this.
Yeah, no, I mean, I think what you're hearing is, and I don't have to say this to this audience, but climate is an everything issue. There's no public health issue that's not impacted by climate. So we are all involved in this, and we need people to bring their expertise from every element of their, if you're a gun violence researcher, if you are working in the schools, heat is an issue in the midst of exactly what you're doing. So we need everyone to kind of come together in that way. What I would say is, so I mean, I think the kind of parallel of we prepare for snow, or at least we used to have it in Boston, is a apt one. And I think there's a the good news about heat is that we can actually prepare. We know when it's coming, and we can get ready for it. But that mentality is getting better. I think attention, understanding of it is getting better. But to start at the education level of public health folks and medical folks, we've started a new concentration here at the School of Public Health that just launched this fall. Everyone here is involved in that. And so we are, creating an interdisciplinary across all departments, all degree programs here, an opportunity to engage with this work more deeply. And again, we're really advocating that, if you're an epidemiologist, if you're a women's health specialist, if you're a global health person, there's opportunities there for you to really dig in and learn this more. We also have a curriculum at the medical school, a 4-year curriculum. So I would say having us health professionals see it and be active in policymaking is really important, so that we're engaging with people like the mayor of Somerville. I think our healthcare infrastructure also has to be really involved. And so, Lindsey and I probably both, I'm sure Lindsey would agree with me that, healthcare is just way too responsive. We wait for people to get sick and then we receive them. We didn't need COVID to teach us that wasn't the right, enough. But obviously we cannot just receive the deluge of people being impacted by severe heat. We have to get out there and be proactive. And so our healthcare systems, institutions need to be really thinking about what a proactive system looks like. And so we could be creating scores. We could be creating lists of individuals who are at most risk because of their underlying comorbidities, because of their zip codes, because of their age, and saying, hey, there's a heat wave coming. There's a bunch of digital messages that can go out, but I'd argue even the personal touch of having nursing and things like that be more proactive is valuable. And then I think we really need to be thinking about our built environment. I mean, heat feels daunting, right? Barrak's talking about growing up where he did. It just feels like, how are we ever going to fight this monster that's coming upon us, right? But in fact, these nature-based solutions are really important. I'm weirdly obsessed with trees all of a sudden. And that when I go on my runs and a tree is looking parched, I'm pulling the weeds. I'm calling the city to water it. It's really important that we actually think of these kind of broad-based, nature-based solutions. Be thinking about, there's some work here about this, right, with the kind of cool roofs, and there's real evidence that white roofs can help dissipate heat. Do we need concrete in all these places? How do we get more green space to absorb some of this? There's cities like Medellin, who are doing amazing jobs of greening cities to absorb some of the heat in a way that it doesn't descend upon people. So, there's a couple different levels there, but health professionals have to just, I really just believe that these decisions are being made by folks that really don't understand some of the data that is being presented here about what is happening to kids and our workers. And I do believe, I'm still struck at when I testify at the State House or City Hall, there's an accountability that happens when you put health in the middle of the conversation, and decisions are just usually being made without the clear and ready to help information and data we have from public health about the implications of the decision. So we need to be showing up in these decision-making spaces.
So I'm going to just get ready to ask your own questions. I'm just going to offer one quick one to you before we turn over to some questions for the audience. I mean, generally when 90% of the climate talks that I go to, they always end with, what are you hopeful about? And quite frankly, I think that's the wrong question to ask folks. It's almost like when you ask about hope, it says that somebody else will solve this problem for me, and it doesn't make you feel like you're part of the effort.
Yeah.
So I really want you to inspire this audience to be part of the effort, and rather than ask about where you're hopeful, what are you determined to change in the climate change battle, and how can you help enlist the folks that are here to get behind you and carry their pitchforks and solar-powered torches to behind you to lead the effort towards. And I'll go to each of you and just where do you want the support, and what are you determined to work on now, and where do you think?
I'm going to give a broad one. Hopefully, this doesn't feel too abstract, but it's kind of a mentality argument. I size up this moment of I do think there was really this blossoming out of the climate movement in the last 4 or 5 years. Greta was on the streets. Kids were getting activated. I mean, I really do think in the last 5 years, it is, there's no climate question in all the presidential debates of 2016. Yeah. And it's become an activating voting issue now. And so that's a very quick change for something that's very complex, right? Climate change is complex, and people have very pressing issues in their lives. And now there's a moral urgency to it. And the Inflation Reduction Act was a very important marker in history of the United States' ability to make change. Health professionals are showing up in places like COP and having health days for the first time. 40 million people signed on to 40 million health professionals signed on to the WHO call for climate action. So there is kind of an awakening of society, of health professionals. But I think it is also just very hard work. If we're decarbonizing hospitals, it's hard to get in the guts of a hospital and do that. It's hard to deal with all these transmission lines and getting onto the grid and getting people to rebuild your city so there's more bike lanes and public transit. And frankly, the United States has a very poor record of building good things, right? And so the mentality argument is this has to be, I would say but I would say actually I personally believe, central organizing principle of how we create society, and it needs to be embedded in every single policy and thing we think about. And we have to do it even when it's hard, because people right now are, there's not political credit getting received for the IRA right now because, the buses are still not on time. The T is a pain, right? The electricity bills are high. Those are real things. We have to make it palpably real palpable in people's real lives that climate solutions are making my life better. And as thorny, hard problems are showing up about affordability, about making these things, we've got to figure it out and keep going. So I think it's a time, I appreciate because there's a lot of this, what do you feel hopeful for? I feel hopeful that we can dig in and not let go and not look away for the long haul. That's what we need.
I will give the two of you a chance on that too, but I want to make sure we take any questions that may be in the audience that folks may want to ask our outstanding panel. Otherwise, Lindsey, do you have a question? Okay, sorry about that.
I was wondering how do you deal with heat in Kuwait? And is there anything that we might think about adapting here?
I'm looking at my wife there. She's from Kuwait as well. So not putting you on the spot. It is very hard because it depends on who is most vulnerable and what people have the agency and empowered enough to make decisions. So think of this as the supervisor that has workers working for them. And these workers are either documented or undocumented immigrants. Some of them are in the informal economy, so they don't have the paperwork to do the work that they're supposed to do, and then think about asking them to pace themselves or doing some training programs to increase awareness about heat. Is this gonna make any help? I don't think so. It is about empowering people to make decisions and empowering people and removing this differential of power between people who hold all the power, whether it be the employer or the government in many cases. So dismantling this is important for heat protection. And I genuinely believe in this. It is important that we make this an opportunity for workers to pace themselves and to speak up when there is a problem. And I'm going to say this, we have to support the unions in doing this kind of work. And in the US, there's a very good example with UPS, the packaging and delivering your packages. And please, everyone, if someone is late to your package, don't be angry, okay? There people are working really hard to deliver these packages. And the unions are fighting for air conditioners. The unions are fighting for good cars that will prevent this excess heat and this exertional heat stroke that is completely preventable. Same thing we will see it in Kuwait with workers. Just try to stop this and break this power differential. I think that is essential, and that's what I would like to keep talking about.
I know there's another question here.
I guess,
Or
a
comment.
similar note to what you said about power dynamics. So I am in Mississippi, so it's hot, and I represent people in prison in the Deep South. So I'm listening to you all thinking now, maybe I have a new cause of action. Of course, we don't yet have a constitutional right to air conditioning, but to the extent that what I'm hearing you all say is this impact has, of course, so many layers, and in a situation where people are incarcerated and have no choice but to work or to stay in or to be in lockdown, where there are no trees. There is nothing but concrete. And when people do get outside, in some instances, they're in a cage. So I'm just saying this because I guess I feel like this is the kind of conversation that, as usual, is like so far beyond or above or outside of the world that I deal with on a daily, whether I'm talking about children, because most children are subjected to the same environment in locked facilities, that to what extent are we able to push this, to everyone in our community, regardless of where you live or how you live, and to the extent that other countries or other places have been able to take the most marginalized into account.
Can I make a quick comment?
Yeah, no, go ahead.
I'll just make a quick comment. I was the population I felt during our conversation wasn't covered yet, was incarcerated. So I was hoping we'd get it in there. There's this piece in the is it the Texas Tribune from a couple of years ago that was this investigative report. I think the implications of heat in incarcerated populations is something we have not studied nearly enough. That is going to be is dramatic, and that report was I had some brief comments in that one, but I think it needs its own attention by itself. Brock was describing some of the for outdoor laborers, we need to be thinking about these kind of interventions, and we need a body of research and interventions that are tailored to specific needs, because it is the humidity issues. You cannot get away from it, as you articulately described. And at nighttime, Lindsey talked a little bit about the dangers of heat at night, which is actually even more dangerous than daytime heat. So the uniqueness of the potency of the dangers in this population deserves its own task force policies.
And I think especially when you look at the juvenile incarcerated population and you look at underappreciated co-benefits, cooling is a massive one, and especially green space is a strategy for cooling, because we already have a whole body of evidence on the benefits of green space exposure in decreasing a range of adverse mental health outcomes over children's lifespan. And that's consistent daily exposure to green space. So if somebody cares about increased rates of behavioral aggression, outburst problems in an incarcerated population, and they say, what's the fix here? It's trees. It's not the only fix, but I think it's a way in, and I think it's one of these places where we as public health practitioners can really make those explicit dots and use what is sitting in PubMed to bring out into policy and practice.
I think domestic violence rates go up
Yep.
as well with heat, so
Yep.
there's your
All forms
your
of
cycle.
violence.
Yeah. I'm sorry. Yeah, the question was there, and then there, and then there. Okay.
Nice to meet you. I work with a team getting education into a prison outside of Denver. I mainly work in Accra, Ghana, bringing ICT centers to 9th graders. And I recently instituted, and we'll start next quarter, next fall, I think, a course that brings botany and forestry into the Harvard School of Design. To me, this is not people and research, this is architecture. And there's something called passive cooling. I'm the daughter of a civil engineer, which is partly a joke and partly true. If you have windows that can open, they can be behind bars so that the guards on the other side can open them. You let the hot air out the top, you let the cool air in the bottom, and you have fans somewhere. Trees are certainly a solution, and you can have urban forestry, and you can have microgreens. I'm not going to go through every project I'm involved with. The other thing is, as part of the architecture, instead of you do have shade because you have ceilings. But as part of the architecture, if it's a multi-story one, or even where the windows are, you have an overhang that produces a shadow. And you also want to think about north-southeast orientation. So depending on that, and I'm not sure which is the best way, I don't remember everything, the shadow, the shade, it's like an eyelash eyebrow over the window will mean that the sun doesn't go in directly. So I don't know if the School of Architecture does this. When I did the forestry course, it was through the biology department. So bringing plants into the School of Architecture is a new thing. You're welcome to talk with the new dean of the School of Architecture about that.
I think it's great. I mean, we obviously, just adding more air conditioning only exacerbates our problem unless we find low carbon ways of doing that.
I just wanted to ask, is there an understanding of the evolutionary response to things across geographies? So Kuwait, for instance,
Right.
the populations, do they respond differently because of how heat they've actually compared to others? And look at the immigrants coming from other areas, so humidity.
Right.
And so the response is different. So just basic physiology.
Yes.
If you look at the North Alaska, they respond differently. So is there basic understanding how can we learn from that if there's an inferior adaptation?
Right. So there are two different aspects to this, and maybe I can make them three. One of them is the biology itself. And this is very well studied in occupational health called acclimatization. When you get a worker that is starting their first day at work and it is very hot, then you have to acclimatize them and let them find their way into the work that they do to get to the maximum. And this came from sports science, actually. That's the origin of it, when they learned that when you run for athletes, that you have to acclimatize to get there. So there is this biological aspect. There is some argument whether it is short-term or long-term, how can this be? But the biggest element is infrastructure. And that is, if you go to Dubai, to Kuwait, everywhere you go, you'll find air conditioners. And that is infrastructure that is supportive for the environment that is out there. Now, if it is very cold in Kuwait, and by very cold, I speak Celsius, so it's about 15 or 11 degrees Celsius. 60, thank you, Tom. If it is 60, then there is no central heating in Kuwait. So that means the house will be at 60 all day long, which is also very bad. And then think of it the opposite direction. In London, for example, or in Paris, where air conditioners are not there, that's a problem when the temperature starts to rise into the 30s Celsius.
Around, 37 will be 98, so. Yeah,
Thank you, Tom.
But yeah, but I
So
think that
that's-
was a Kuwait question. I think that was for your wife.
Oh.
Yeah, no.
Tom, can I just say one thing
Yeah,
about the
yeah,
air
sure.
conditioner thing? So I feel actually pretty strongly about this. So I had previously felt tortured about this. It is the air conditioner conundrum, right? That air conditioners have refrigerants that are greenhouse gas, cause greenhouse gas effect, and they're a ton they take a lot from the grid. So they're running off of fossil fuels. So we are cooling ourselves off, which is warming the planet, which continues a positive cascade of the bad kind. Number one, I think we have to make sure people are able to stay cool and safe in their home. I think it's a right that people we're not just neglecting folks, especially in the global south, and just saying, well, it's too late and you're going to have to bear the heat without cooling devices. I just want to make sure, I'm actually still surprised at how many people don't know about heat pumps, which are like splits. And so I actually do think these are one of those kind of magical climate solutions, which is adaptation and mitigation at the same time. So, heat pumps take way less pressure onto the grid. They don't have the same kind of refrigerants. The technology is getting better and better. So this is, I would advocate for all my patients that they have the opportunity that we can get these cooling systems into their homes. And I think we now have technology that helps us avoid the problem. I think we should stop talking about ACs and be going straight to heat pumps, which is a bad name because they cool and heat at the same time.
I think that's a great point, but we still get into the affordability issues.
Yeah.
And is it cheaper for us to subsidize electricity for populations
Yeah,
during
I
certain
agree.
days than to pay for them to come to the emergency room and use the healthcare system?
Yep.
Yeah, at Boston Medical Center has this incredible pilot program where they have installed solar panels on the roof of the hospital and then partnered with the state's Eversource, the energy provider, and actually redistribute the credits that the hospital receives from the solar power in the forms of patient credits, like to their patients' energy bills. And all you need to have is an Eversource account, and it's like a direct credit to your bill. And so they're trying to partner with other local businesses and expand this to other hospitals. But it's incredible. It's another one of these times where we're actually decreasing our combustion of fossil fuels and putting money right back into people's pockets. And so it allows you to, in terms of access to cooling and interim measures while we get onto these heat pumps, at least people who have air conditioners in Boston, which is not super common, can afford to operate them.
That's great. We have time for one more question. Sorry, did you still have a question? Sorry.
I was going to ask about the air conditioning conundrum, but so there's a lot of possible solutions like architecture and green space and heat pumps. What should we do? You may have already talked to coalesce these things and advocate for them, and not just say, well, there are a lot of solutions. Somebody has to make them policy, or what should we as people here do? Do you think?
I don't want to. I think it's money and bills. We just have to keep passing bills. I mean, it's like we know what to do. I mean, the person who's speaking about the architecture and all that in jails. Of course we could do that. Of course we could keep jails cool enough to be humane. It's a matter of caring. It's about seeing the humanity of those people and spending the money that we need to make sure people are safe. Yeah, I always come back to legislative advocacy.
I think so. I think there's also a huge role for the private sector here, and I think each of us probably sits right in this room in a slightly different place. And so I think it's connecting whatever the issue is that the people you work with care about, whether it's prisons or community centers or whatever, back to climate through a backdoor lens. So when I often, in a lot of the audiences we talk about, I don't talk about climate change because they don't believe that it's a thing. Or, you can talk about how temperature is affecting X, right? Or how the cascading effects of water-related extreme weather events are impacting Y. So I think if you don't have the ability to impact policy directly, there's still some program service infrastructure that we probably do.
I'm going to let one more come in because your hand was so quick, but I had already picked.
Thank you very much. My question has to do with adhering to two issues. One is related to climate change, and the second one is the unrecognized effects of heat that I didn't fully appreciate before and practical ways of dealing with it. And I sometimes feel that putting them two together makes me a little more confused when I hear climate change. I'm not sure how much of the problem has been there for a while, whether it's the sugarcane or the prisons or issues in Kuwait or even the schools being hot, and how much of it is new. And so I'm trying to like piece it together.
There was a study that came out a couple of years ago that because of climate change, we think that there's 37% more heat-related deaths. And we are having a massive problem of undercounting heat-related deaths. So honestly, I think combating climate change is very hard, but actually simple. And I think we need to just come back to the point that we have to stop burning fossil fuels, period. And we have better solutions now. We're short on time, but there's the climate change impacts on existing heat are complex. They make a thing we didn't bring up enough today is that heat is most dangerous when you're going from point A to point B. So if you're in Minnesota and used to a certain amount of heat and then you're being exposed, it's that change in heat and your ability to say, my body's not used to that, where a lot of the morbidity and mortality is happening. So climate change is making these heat waves erratic and disruptive in a way that is not natural. And, so it is, heat is always dangerous, but climate change is making nights a lot hotter, more humidity, all these kind of things. So it's absolutely exacerbating existing issues.
I did a little research on when the peak temperature in Boston was recorded. And anyone want to take a guess as to when the highest temperature? It was 104 degrees, just temperature.
2016.
It was actually 1911, is what it said. But when was the highest heat index day? That was this past summer, and the sustained days of heat index. So it's not just about peak temperature days per se. It's the idea that the overall heat stress is.
One quick stat is at baseline, Boston's used to about 10-ish days of over 90 degrees of heat, and there's modeling concerning that we'll get up to like 90 days of that. Yeah. So we're talking about pretty dramatic change.
Yeah, we'll have the climate of Alabama in like a few short years.
So any closing comments from any? We have about 5 minutes left, and anything you want to just make sure that hit upon for the group? Any of those rallying the troops to behind?
I can just the paper that Gaurab just mentioned. I was involved in that paper, and it really showed that climate change is claiming lives now in terms of heat-related deaths. That was 37%. That's the estimate that the models that we had that showed that these 37% of heat-related deaths are directly attributable to climate change. But the other issue is that it is getting worse. By any metrics we choose, by any pair of eyes that we place on whatever condition we're looking, and it is getting worse. So that is one problem. But when the opportunity presents itself, like this OSHA regulation that we have right now, there is a chance that we can push this over the line and we get it done, and we provide at least just baseline protections for workers. And this is not rocket science. This is water, this is shade, this is rest. That's it. If we cannot provide this for the workforce that power through this economy, then what are we doing actually?
Well said.
Thank you.
I think I'd like to just add to the question that you asked earlier in that, there's always been these existing inequities in children's health, in health of workers, in access to cooling for people, and this delta temperature, the change in temperature that we're seeing, even on days where it's not extreme, it's flowing through and amplifying each of these inequities in ways that is making them, and we've measured this across a variety of different outcomes, wider and wider. And you can look at school attendance and days lost for hot learning, as an example. The places that are the hottest, the neighborhoods that are the hottest are also the places that have the lowest rates of school air conditioning. And so now in Boston, even if it's a little bit too hot a week into September, those kids who are already having the biggest disparities in learning for a number of reasons, including heat, are the ones missing the most school days and the ones who aren't going outside for recess. And so that's happening across all of these different issues. But I think in terms of the solution space too, you were talking about, what are we thinking about climate in every decision that we make? I'd also say that if climate is the meta issue of our time, then children are the meta issue of climate. Where if you look at addressing and improving every single aspect of this, every solution that is good for climate change is also really good for children's development and good for the outcomes that everybody in this room cares about. So if we want to reduce obesity, diabetes, heart disease, Parkinson's, Alzheimer's, protect people when they're pregnant and before they're pregnant, and we're going to actually improve the health of the planet and the future workers. And so be my plug for.
That's great.
Yeah.
I'll leave you with four resources, 3 associated with the university and one not. I mean, I know that the White House had promoted heat.gov as a reference database, and I think there is a lot of good resources for folks to take advantage there. I think the student presentation earlier talked about the AmeriCares partnership with J&J and the Sea Change organization. Great resource for clinics in terms of a toolkit and getting ready for it. There's also the Sea Change website itself, which has a lot of resources for clinics for dealing with this. And the last one I'm going to make a pitch for is I'm part of the Harvard Alumni for Climate and Environment. That's a 2,500 alumni network across all of the schools. And this idea of breaking down silos, that's one way for us to work together on these things. So I encourage all of you to get involved in that. One of the things we're going to be doing is kicking off a series around climate and health, around mental health, but we are going to bring in how to declimatize the health sector and bring in Anna Goldman, who you were referencing for the Boston Medical Center, and how the strategies that they've used to help the community. So I encourage you to sign up for that, get inspired for our closing session later. And because you did such a great job, we're going to be able to celebrate with champagne before. And do you want people to go up for the after? Not? Okay, great. All right.
Thank you. Thank you.
Thank you. Thanks for our panel.